irregular periods, painful cramps, weight gain, trouble getting pregnant. What if I told you PCOS and endometriosis are not the same, but many women are being treated like they are? Today we are breaking down PCOS and endometriosis. These two conditions are very common and affect millions of women all over the world. Yet they are often misdiagnosed, confused, or ignored. What is PCOS? PCOS stands for polycystic ovarian syndrome. It is a hormonal disorder, meaning the main problem is hormone imbalance, especially high male hormone called the androgen. What happens in PCOS? The ovaries don't release egg regularly. Ovulation is irregular or absent, and follicles may appear on the ovary, then insulin resistance. It is very important to know that those cysts are not dangerous growth. They are immature eggs that don't ovulate. Common PCOS symptoms are irregular or missed period, weight gain especially around the belly, acne, excess facial or body hair loss, difficulty getting pregnant, dark hair around the neck or the armpits. PCOS usually starts from teenage years or early adulthood. What is endometriosis? Endometriosis is not a hormone disorder, it is a pain disorder. And it happens when tissue similar to the lining of the uterus, that's the endometrium, grows outside the womb. It can be on the ovaries, fallopian tube, bowel, bladder, or pelvic wall. What happens in endometriosis? The tissue grows where it shouldn't, it thickens and bleeds every month, but the blood has nowhere to go. So this causes inflammation, scarring, and severe pain for the patient. Now let's talk of the symptoms. Severe menstrual cramps that doesn't improve with painkillers, chronic pelvic pain, pain during or after sex, heavy or painful period, painful bowel movement or urination, most especially during periods, bloating, fatigue, and difficulty getting pregnant. Endometriosis pain is not a normal period pain. It can stop women from working, walking, or living normally. Please always reach out to your doctor. Now let's talk of the key differences between PCOS and endometriosis. Pain level. For PCOS, mild cramps or discomfort, but for endometriosis, severe life-disrupting pain. If pain is your biggest symptoms, it's most likely endometriosis. Periods. In PCOS, periods are irregular, missed or absent. While in endometriosis, they are regular but extremely painful and heavy. Weight gain. For PCOS, weight gain is due to insulin resistance, while in endometriosis, weight gain is not directly linked to it. If weight gain is sudden, stubborn, PCOS is most likely. Fertility. PCOS affects ovulation, so usually most women have trouble in ovulating, while in endometriosis, scar tissue blocks eggs and sperm from movements. Both of these causes infertility, but for a very different reasons. Can you have both PCOS and endometriosis? Yes, some women have both. This is where many women are misdiagnosed, are told everything is normal, and are given treatment that doesn't work. If your symptoms doesn't fully match one of these conditions, push for further testing. How are they diagnosed? For PCOS, period history is very important. Blood tests and ultrasound to check the ovaries. While for endometriosis, diagnosis is usually through laparoscopy. MRI can help in some cases, while ultrasound usually misses. So what are the treatment options? For PCOS, treatment include lifestyle changes, dieting, and exercising, weight gain management, hormonal birth control, metformin, and fertility medication, that's if you desire pregnancy. Now let's talk of endometriosis. Endometriosis are usually managed with painkillers, hormonal therapy, and surgery in severe cases. When should you see a doctor? See a doctor if your period pain stop you from your daily activities, your period disappearing for several months, you've been trying to conceive for over a year, or painkiller doesn't help your cramps. Please, if you feel dismissed or unheard, your pain is real. PCOS and endometriosis may share symptoms, but they are very different conditions. Understanding the difference could save you years of confusion. Preventing unnecessary suffering help you get faster treatments. If you want to understand more on PCOS I have a video in my channel. The link is, I'll put it here so you can watch it out to understand more on PCOS. If you benefited from this video, please don't hesitate to like, share, and comment about your own experience or someone else. See you in my next video. Bye.